Hey guys, my name is Matthew Petrov, and today we are going to be talking about Salmonellosis. Salmonellosis is a disease caused by the Salmonella bacteria. It was identified in the 1800s by a scientist named Salmon. Salmon here was actually looking for hog cholera when he found Salmonella. Cholera and Salmonella shared the symptom of diarrhea, and so as Salmon was looking for hog cholera, he found Salmonella instead and later identified it. There are two species of Salmonella, Salmonella enterica and Salmonella bongori. The Salmonella bacteria is a motile, gram-negative, facultative anaerobic bacilli that has flagella. As you can see in this picture here, the pink shows the gram-negative, the rod shape shows the bacilli, and you can see the flagella sticking out. There are more than 2,500 serotypes of Salmonella. Serotypes are like subclassifications of a species. And of those 2,500 serotypes, only less than 100 are actually disease-causing. And those that actually cause disease are classified into non-typhoidal and typhoidal. Non-typhoidal occurs both in animals and humans, while typhoidal only occurs in humans. For typhoidal Salmonella, they are caused by Salmonella typhi and Salmonella paratyphi. If you're wondering about the naming, because I just told you there's only two species, scientists have shortened the name of Salmonella due to the numerous serotypes, and so they just identify them now as genus and serotype, so Salmonella typhi. If you were wondering, the species is enterica though. The incubation period for Salmonella is 6 to 72 hours. Symptoms last 2 to 7 days, and symptoms include fever, abdominal pain, diarrhea, constipation, nausea, and vomiting. This is for both non-typhoidal and typhoidal symptoms. Sorry, these symptoms are for both non-typhoidal and typhoidal cases, but typhoidal cases also have some other symptoms other than these. For non-typhoidal, these are usually mild cases and do not really need any specific treatment, like antibiotics, though dehydration can be severe and life-threatening, such as with cholera, due to like diarrhea. This right here is a chart of invasive non-typhoidal Salmonella per 100,000 in each age group. As you can see, those under 5-year-olds are more susceptible to dying for it because of their lack of an immune system. And so you should keep them away from any raw meat or raw eggs if possible. For typhoidal Salmonella, they have extra symptoms such as typhoidal fever or typhoid fever, which may cause intestinal bleeding and infection of the brain. Other symptoms include rash, loss of appetite, and rose spots. This picture here down below, they look like sort of like blisters on the skin in this picture. Those are actually what we refer to as rose spots. They are caused by bacteria emboli to the skin. An emboli is like a cluster of bacteria that travel through the bloodstream, and eventually that bacteria gets stuck in smaller blood vessels, and that's what causes these red marks to appear all over the skin. This here is a map of the incidence report for typhoidal Salmonella per 100,000 people. As you can tell, the typhoidal Salmonella is more prevalent in Africa and India. So Salmonella is transmitted mostly through the fecal-oral route. So the bacteria tends to like cholera, tends to like the intestinal tract. And so when humans or animals release feces, they can contaminate water, land, or people's hands. People can touch them, and eventually it gets to the food and it leads to the mouth, and the route just repeats and repeats. Transmission includes direct contact with animals, such as if a chicken or dog has feces, sometimes those feces get stuck to the fur or the feathers, or even the skin on a reptile. And when humans touch those, they get it on their hands, and then they can transmit it from hand to hand, and then transmit it from the hand to inanimate objects. And from then it can spread. Indirect contact with indirect transmission are those such as like the environment, such as water or even the dirt that's been in contact with the feces, or even once like you slaughtered the chicken for its meat or the cow for its meat, then that raw meat, if handled improperly, can contain the Salmonella bacteria, and that Salmonella bacteria can then be ingested, and then the bacteria can get to the intestine, and the fecal oral route continues all over again. If you're wondering, yes, it also occurs, transmission can occur in fruits and vegetables, and even on turtles. The pathogenesis of Salmonella is almost like cholera. So you ingest the organisms such as with raw meat. The organisms then head towards the lower intestine and invade the mucus lining. This eventually causes a acute inflammation due like the use of cytokines, and these cytokines eventually lead to diarrhea. Here's another picture of entry, the disease spreading, going to the or going to the GI tract and leading to diarrhea. This here is an in-depth detail of it. So Salmonella go to the epithelial cells of the intestine. They penetrate the intestine and then multiply in there. And during the multiplication, they infect more cells. And then these infected cells release pro-inflammatory cytokines. This causes gastroenteritis, which is inflammation of the intestinal tract. This inflammation eventually causes the abdominal pain or diarrhea. And these bacteria can also enter the blood, as you can see here, called bacteremia. And this may cause enteric fever because the bacteria then goes all over the body. They may get into your bones, into your liver. They may even infect your brain, which is not good. Salmonella can even become a chronic disease. This is really interesting. When the Salmonella goes into the bloodstream, sometimes it can go to the gallbladder. The Salmonella in the gallbladder then attach to the gallbladder and make a biofilm, and eventually it just sticks there. And when the bowels wash over it, because you're going to the restroom and releasing feces, the bacteria just comes out. Small amounts of bacteria come out with it, and you can still infect people. Even if your antibodies and your immune system eliminate the bacteria, and the Salmonella can still be found in the gallbladder. The only way to eradicate it is through a prolonged use of antibiotics, and even then, it may take a while to get rid of. And most of the time, people don't even know that they're infected because they don't have any symptoms. One such carrier of the disease was Mary Mallon. She actually got the nickname Typhoid Mary, the most harmless and yet the most dangerous woman in America. This is during the 1900s. She was this is in 1906. She was a household chef and was a carrier, and infected around 100 people, and had at least 3 certified deaths caused by her. This is before they had any immunization to Salmonella. Immunization was made in 1911, and in 1948 they finally had antibiotics to fight against Salmonella. So before this time they didn't really have any of this, and Mary eventually just infected a whole bunch of people. To diagnose Salmonella, usually you use symptoms such as if you have the typhoid type, the typhoid fever, or rash, or rose spots. If you have the non-typhoidal type, then it's probably you're going to have to look for the diarrhea or the abdominal pain. If you want a good test or a accurate reading, Usually you want to do the clinical tests, such as the blood samples, urine samples, fecal samples, or tissue samples. These tests can be used to find, like, if you specifically the fecal test can be used to find if you are a carrier. And usually they diagnose it by the symptoms first, because by the time the clinical tests come back, the patient, especially in non-typhoidal cases, is already better. Treatments for Salmonella include water, such as IV fluids if dehydration is severe, as said before, and mostly just rest, because non-typhoidal cases are not as severe, and so you can recover very quickly. Antibiotics are used in severe cases, though, such as typhoidal cases, but specifically for non-typhoidal cases, they tend not to try to use antibiotics, because that can actually prolong the infection. Also, there are some resistant strains to the antibiotics, so they don't want to make the disease even more resistant. To prevent Salmonella, one should always wash their hands. Of course, like after you touch an animal, after you come back from playing outside, you should always wash your hands. For those on the farms, there are vaccines for animals, for the non-typhoidal case, not for the sorry, there are vaccines for animals, but on the human side, there are no vaccines for the non-typhoidal cases, but there are vaccines for the typhoidal cases. The bacteria can spread as long as the bacteria is in feces. This is going back to the chronic cases, such as when the bacteria is in your gallbladder. To prevent it, make sure you keep food preparation surfaces clean. Make sure when you're using a cutting board, you don't place your raw meat on it and then cut your vegetables on the same plate without washing it first. You want to handle your food properly. Make sure you're not like grabbing the raw beef or anything and wiping it everywhere. You want to use safe waters and materials to prepare food. You don't want to use any, especially for places such as Africa, you want to try to use sterile water and water that has been boiled. And of course, you always want to avoid eating raw eggs, unpasteurized milk, and raw meat. And always wash your vegetables and your fruits. And I didn't put this on here, but make sure you should not be eating stuff off the ground also, because bacteria can stay, the Salmonella bacteria can stay on inanimate objects for several weeks in dry climates, and then several months for wet climates. And you don't want that anywhere in you. There are actually some outbreaks that are pretty modern. So in 2022, there was a chocolate outbreak. So Salmonella had gone into chocolates, and there were 151 cases in April 25th of 2022. And then there's a recent outbreak too, like maybe 2 weeks ago, on cantaloupes. A day, or I guess on Friday, a report came out that there were 117 cases, there are 2 deaths, and 34 states have been tested positive for having Salmonella. If you're wondering how cantaloupe can somehow contain Salmonella, is due to like poor handling of the food, and sometimes the Salmonella gets trapped in Salmonella that's like stuck in water gets trapped in the cantaloupe skin, and then so when you're cutting it, sometimes the cantaloupe can get on your hands, and then when you're eating it, it gets into your body. And that was it. Thank you so much. Have a good one.